pressure on the belly. So I think he's trying to like lift his belly up.
To keep, okay.
Yeah.
Is there anything I can do at night to help him? Give him a pillow and he'll adjust himself on the pillow?
I think a pillow would be a great idea, and I also think we can maybe send him some gabapentin to help with pain.
Okay.
Too. I think the combination of the two.
Okay.
To help him get some better rest.
Okay.
Okay. I can't send him home more than a week of gabapentin, but I can send you gabapentin to help with it. Okay.
Okay. Is there anything else we need to look out for? Anything we need to...
I mean, the biggest thing is, like I said, he's not...
Temperature.
Oh, yeah, we can get temperature. More like critical thing, like he might need surgery sooner, would be like if a mass rupture, right? That would be our scariest thing.
How would I know?
His gums would get pale. His heart rate would get higher. He'd be really lethargic.
Is there any way you could write down what his heart rate should be, what his temperature should be? Can you give me his what vitals are normal?
Yep.
Because I was a nurse, I worked in the hospital.
Sure. Yeah.
Which I know it's not the same thing, but
okay.
I can do his vitals.
Yeah, for sure. I don't want you to stress, but I don't want you to like obsess over it, okay?
I am.
I know, but I see that. I'm trying to tell you, please take a deep breath, okay?
I came in here bawling, so I had to take a Xanax. That's the only reason I'm not sitting here crying.
I feel like, yeah, it's okay. I'm sorry, I know he's your baby. But yeah, so those are more like the scarier signs, but they also like, you'll know. Like, I feel like it's hard because, again, like my least favorite, most traumatic type of diagnosis is that I was talking about the tumor on the spleen before. Like when those come in, they're usually what we call a hemoabdomen because it's the splenic mass has ruptured. The owner didn't know it was there, and all of a sudden their belly is distended and it has what we call a fluid wave. And
like that thing kind of?
No, that's not fluid wave right now.
Oh no, but would it look like that kind of?
Yeah, so when you touch it, it kind of like does like the wave effect.
Oh, yeah.
Yeah.
Okay.
So and like it's awful because they had no idea this was going on. I mean, they have usually an older dog, but like, they didn't know anything about it, and like they literally have to make a snap decision. Am I going to spend all this money to immediately possibly give this dog a blood transfusion, go to surgery, remove said spleen, knowing it's likely cancer, and they're going to get maybe 4 to 6 months at best, despite all of this, or like, and it's, it's not about the money, but it's like, like also quality of life, right? Quality versus quantity. Like, if you're going to get another awesome 6 months, great, but like a lot of people are, it's just everyone's choice is different, and I don't fault whatever they choose. It's a really hard, it's especially it's such a shell shock because they have no idea, and all of a sudden they have to make this decision to make their dog, say goodbye to their dog. All of a sudden, they had no idea. I feel like it doesn't make it better when you know, but at the same time it does in a way. Like it's still awful news, but you can at least semi come to terms with it and have a chance before like hitting that point. But anyway, so basically, I think we can treat him outpatient. I think we're okay that way, okay, for right now. But those would be the scarier things to see is his respirations will probably get increased because, and a lot of people say they notice they get wobbly because they're weak because, their blood volume in their circulation is reduced.
How long ago did that happen? 2 months ago?
You were telling me about that episode where he had that weird like...
Yes. Yeah. And he's never done that before.
I think
and that he was drooling.
Might have been more of a vagal episode because, again, this mass is like really close. So your vagus nerve runs on the inside, like under your spinal cord, right? But like along the inside of your body, along your back end, and it's your biggest nerve in your body. And sometimes they will have careful.
Oh, we're all three handicapped in here.
They'll have like, it can sometimes look like a fainting episode, but like it can also be more of a, like a lot of times a dog will like, sometimes they'll have an episode like when they go to vomit, like they go and they just trigger that nerve, and then all of a sudden they kind of like go really weak and like kind of lose it for a second, and then they pop back.
Yeah, he didn't do that. He just did the head wobbly, and the problem, and I feel bad, but I had to take my attention off of him to the other little one because she was having an active one.
Yeah, you were telling me that, yeah.
And when she has seizures, she goes flat on the ground and then just vibrates and she can't get on her feet, and then she panics. So I got to pick her up. We got to turn all the lights off, put a cool rag on her. I mean, the whole nine.
Yeah.
So then all the other dogs are neglected until
They're not neglected.
we literally lock them in another room
That's not neglect. it's
because they
okay.
want to bounce all
Well,
over.
you're trying to keep them safe and you're trying to keep her safe. That's not neglect. It's
And I
called
kinda-
caring for your creatures.
And
Okay.
he had one at the same time, and I had to pick.
I think he just had maybe a little bit of a. I mean, also when you get really dehydrated, you also get, you kind of also have those episodes. So maybe if he wasn't drinking as well then either, maybe it was partially related to that,
Well, he does that a lot.
that behavior,
Yes.
that's sometimes a sign of pain.
Okay. He does that 24/7, nonstop.
My older girl's starting to do that too more, so it can be a sign of pain. I think let's get him sometimes it can be nausea, but it can also be pain.
Okay.
And then he's drooling right now. He
Yeah.
usually doesn't do that
Is that nerves or is that nausea, bud?
unless it's a TREAT.
Yeah, he doesn't drool.
It's okay. You nauseous, bud?
Yeah,
Yeah.
he's drooling.
Yeah, he seems like he's
Now
not.
the last time he drooled like that, he went into that episode.
Okay.
And I could tell with his eyes.
Hey, bud.
Here, I'm gonna end this. Okay. Hey, yo, your mom.